I have somewhat of a unique practice in that I've taken time doing subspecialist training, both adults and growing athletes. I specialise in hip, knee and ankle surgery, and I treat all ankle and knee sporting injuries, and I have a special interest in ACL reconstruction and ankle ligament repair. I also perform hip replacement with a direct anterior approach and knee replacement using 3D patient-specific technology. As a surgeon, my philosophy is to perform only a small number of operations, perform them regularly, and perform them really well. I'm not a generalist orthopaedic surgeon who performs a large number of operations all over the body. And that level of subspecialist care is really important to me because I believe it gives my patients the best results. I'm very fortunate to be a consultant orthopaedic surgeon to a number of professional sporting teams in South Australia, and that includes teams in the AFL, AFLW, the SANFL, Super League Netball, and also the NBL. In those particular athletes, the difference between winning and losing or success and failure can be millimetres. And being part of a very large team that helps that athlete return to the sporting field at the highest level is really satisfying to me as an orthopaedic surgeon. But I get just as much satisfaction and provide exactly the same level of care when I'm helping a weekend warrior, an emerging junior athlete, a mum, dad or grandparent to return to whatever it is that they love doing in life. Being a parent is absolutely fundamental to me being an orthopaedic surgeon. It's really helped me to understand when parents bring in their children with injuries, what they're feeling, what they're going through, and how suddenly everything changes for the entire family. And it's an absolute privilege of my job that parents entrust me to look after their children. I'm also just a big kid at heart myself, and I think that really helps me when interacting with younger patients. I've got no doubt that the somewhat unique and humble upbringings I had as a kid and growing up in a country town and some of the experiences I've had in my life help me every day interact with my patients. And I think that my patients really do appreciate that more human and personal approach that I have when talking to them about issues that can be quite serious for them and their family. It's also really important to have a laugh from time to time with my patients, and I really think that you can't take yourself too seriously. I really enjoy performing surgery. Surgery is a form of art, and one of the things that I love about operating is mastering a particular procedure, when I can really honestly get into the zone and provide that patient with the best possible care that I can. Because I know that if that was my wife or mum or dad, brother or sister, or my child on that operating table, that I'd want them to have the best surgeon that they possibly could. I'm Matt Hutchinson, and I'm a hip, knee and ankle surgeon.